Good afternoon, everybody. I am a misfit. I tend to do everything slightly differently, and I'll do this a little differently as well. As you'll notice very quickly, there are absolutely no slides. I don't do boring. I don't do slides. And actually, to be honest, I don't like doing monologues either, so I would much rather make this a bit of a conversation. So I will tell you my story, or the story, fairly quickly, and then I'll open it up, and I'll encourage you not to be shy. My story tends to trigger a whole bunch of difficult, uncomfortable, complicated questions, and people are dying to ask those questions, so please don't be shy in front of 300 of your closest friends, and just put up your hand and ask me as we go. You have been talking all day here at this conference about health, and about innovating health, and about digitizing health. And really, it's all about health care, about how to get more efficient, how to get smarter in how we take care of people. And of course, the reason we do that is because we want to, A, improve the quality of life of our fellow citizens, and B, get them to be taken care of more efficiently. We're trying to create a more efficient society in how we fix people. But what we often forget is one of the biggest areas of opportunity for us to become more efficient as an overall healthcare system is health promotion. We invest an enormous amount of our attention and our money, frankly, on innovating healthcare, but we often forget about how to innovate health promotion. And I would argue that health promotion, just like many other positive policy areas that our governments have focused on over the decades, is one that has been fairly static in terms of how it gets delivered to us. When you think of how governments talk to us about anything good, anything positive about our lives, historically, not just in Canada, but everywhere in the world, governments have a very unidimensional relationship with each of us, and it's only through some form of advertising. If a government agency wants to convince us to get our flu shot, or to not smoke, or to exercise a little more, or to eat healthier, the only way they can accomplish that, or have been accomplishing that historically, is by running some sort of an ad, whether it's a Facebook ad, or some nasty message on the back of a cigarette pack, or a billboard on the street. It's typically advertising that we pay attention to, or that at least our government agencies think that we pay attention to. And nobody has tried to disrupt that space, until we came along. We showed up a couple of years ago with an idea that was actually sort of co-invented between my completely crazy company and the federal government of Canada. The Public Health Agency of Canada sat down with us and determined that the time had come for us to try and communicate with Canadians differently, to forget about advertising, to forget about the sort of flat approach of throwing something out there and hoping that people might see it, hoping that we might get a little bit of a proxy of a result of how many people saw it, but really just spending money with very little accountability, and instead come up with a completely new way of connecting with Canadians the way they want to be connected with. Think about the two biggest national social habits, otherwise known as addictions, that we have as a nation. One of them is in your pocket, and it's called your smartphone. I can't imagine that there is a single person in this room doesn't have their phone with them right now. I would call that an addiction. The other one, which is just as remarkable, and it's very Canadian, by the way, is points. We are crazy about our points. We are actually the most points-addicted nation on the planet. Nobody knows why, and often, because I come from the points industry, I've had to sort of theorize about how this came to be. But we are truly the most points-crazy nation on the planet. We chase points everywhere, at the grocery store, with our credit card, on our flight. And the remarkable thing is nobody had ever thought of finding a way to combine these two addictions into a single thing that'll actually change our behavior for the better. We came up with this crazy app that those of you who live in some provinces in our country, like Ontario and BC and Newfoundland, would recognize immediately because it's become so popular. We created an app called Carrot. Funny choice of words, of course. I was accused by a couple of brand people in the early days that I was coming up with something that was a little bit too obvious and too manipulative, and perhaps consumers would hate it. But as it turns out, consumers loved it. We created Carrot, an app that gives you points, whatever points you love. If you happen to fly a lot, it gives you aeroplane miles. If you happen to go to the movies a lot, it gives you scene points, and on and on and on. So the choice of reward is yours, and it's one that's very recognized, and it's in your life already every single day. And it gives you points for every single time you look at it. Every time you take a quiz about why the flu shot might be good for you. Every time you achieve your daily step target. Every time you watch a video about healthy cooking. Any interaction you have with this little thing that sits on your phone, you earn points from it. Our theory was that if we created such a thing, people would pay a lot more attention to it than they would to a TV ad telling them to go get their flu shot. If you know anything about the advertising industry, the marketing industry, one of the gold standards we have in that industry is the 1% conversion rate, as we call it. If 1% of the eyeballs that see a billboard or a TV ad go and do what we ask them to do, that's considered to be a success in the marketing industry. Think of how poor a bar that is. That means 99% of people that see an ad don't do anything about it. We celebrate the ads that hit 1%. Well, believe it or not, the day that we launched Carrot in one little corner of the country, we launched it in British Columbia, and we had expected to do a lot better than advertising. We expected 10% of the people that would see something on the app to actually go and do it. That first day, we got an 83% conversion rate. So almost every single person that saw a quiz or a video or some other sort of ask of them to completed it. Why? A, because it was on their phone, so it was with them all the time. So if they're sitting at the bus stop and they had nothing better to do, they would just take another quiz. B, because they got points for it. You have no idea how the general population overvalues points when it comes to like tiny, tiny incentives in their everyday lives. Believe it or not, we give Canadians a remarkable 2 Aeroplan miles per day, or 4 scene points per day, depends on the currency. I use Aeroplan all the time because that's what I choose to collect on the app. We give them 2 Aeroplan miles per day for achieving their step target. If you know anything about Aeroplan, you would immediately say to me, oh my God, 307 years later, they might get a free flight. And yet, get this, for 2 Aeroplan miles per day, we have taken half of the population. So something else you may not know is that 50% of us, literally 50% of Canada, are considered inactive or sedentary because we walk less than 5,000 steps a day. We took that half of the population, and 8 months into their life with this app, have increased their daily walking, not by 1 or 2 or 5%, but by 29%. So people chase those points. We've had an absolutely dramatic change in behaviors out there just because we give them this tiny, tiny little carrot every day. In fact, one of the things we laugh about is how many tweets we get late at night. I'll be with you in 1 second.
Oh, you said we could ask questions right away.
By all means, go for it. I think somebody has to throw the little mic at you so that everybody can hear your question.
Okay, I'll wait for the mic.
No, don't worry about it. Go for it.
No, my question is, you know, these all the polls and that we've had recently are all fake news, as you know. And so I'm just curious how you sampled and got these amazing statistics of 29% improvement in, I mean, you didn't ask me. I don't think I would have gone 29% for 2 points.
It's not based on a poll. The nasty thing about the phone that you carry with you every day in your pocket is it actually measures your steps every single day. Every phone that we have on us these days contains an accelerometer. And whether we have an iPhone or an Android phone, there is a health kit type app inside the phone that tracks your steps every single day, whether you like it or not. All we do with hundreds of thousands of Canadians on this app is we get your permission to access that data, and then we begin to track your steps every day and tell you about it. And it's amazing how that gamification of it really works. Because we will say to you, you are at 7,500 steps today. Your target, your personal target, which is based on your historical average, happens to be 8,200. 700 more steps and you'll earn your 2 Aeroplan miles. And people go crazy. We have so many people tweeting at us late at night saying things like, damn you, it's 5 to midnight and I'm walking around my apartment building. In fact, I got to tell you, the most remarkable one I saw was a week and a half ago. I was in Montreal with a colleague of mine. She's worked with me since the beginning of the business. She's a young woman. She's fairly fit. It was raining in Montreal. We both ended up back in our hotel rooms fairly early in the evening, and then she texted me and she said, essentially, damn you. She was walking up and down her hotel room for 40 minutes because she was 3,000 steps short of her target for the day. And she couldn't imagine not getting her points. So, joking aside, the results on the physical activity alone are so dramatic with this app that even we cannot believe it. There's this well-known fact from Health Canada that every 1% increase in the physical activity of our fellow citizens, of Canadians as a whole, generates about a $2.6 billion savings per year in healthcare. 1%, right? And here we are taking half of the population and moving them up by 29%. And it's peer-reviewed. It's been published already. So it's not something that we make up. And in fact, that's the other remarkable thing about a new platform like this. None of it is based on proxies or estimates. All of it is based on real fact. We can push out a quiz about the flu shot, and we can come back to the authorities in the provincial government that wanted that quiz pushed out and tell them exactly how many British Columbians do not believe in the flu shot, or exactly how many British Columbians that are female do not believe in the flu shot, or in that income bracket, or in that postal code. We literally come back with real data every single time. The previous model, which was advertising, was 1,000% based on proxies. You would literally say that billboard at the corner of Yonge and Bloor in Toronto is typically seen by 60% women, 40% men, who are typically between the ages of 35 and 55. So proxies would give you absolutely no trailing data. They would just give you an estimate. We, on the other hand, with this new thing, are producing real data. And real data, of course, drives even more real behavior change in the long term. I'll give you an example of how you can use data to create behavior change very quickly. Back to the flu shot. Last fall in BC, we decided to run a very nudge-compliant, you guys must be familiar with nudge theory, I presume. We ran a nudge-compliant experiment on flu shots where we gave British Columbians a few points for answering a quiz about their attitudes on the flu shot. And as soon as they told us how they felt, if they were cynics about it and didn't believe in the flu shot, we would take them down a certain path where we would give them subsequent quizzes and educate them further about the flu shot. If, on the other hand, they said they believed in the flu shot, then we knew they were ready to go for a flu shot. And so the next thing we would do is give them a few more points if they simply opened a map on their phones, if they clicked on a map on their phones. That map, which was fed to them by the app, by us, would actually show them how close they were standing at that very moment to a flu clinic. Because when you think about it, if you want the flu shot, one of the biggest barriers to you getting it is convenience and proximity. You don't know where the flu clinic is. You're standing somewhere, you're frustrated, you just don't want to bother going to the clinic. But if you know that it's across the street, the odds of you going have increased dramatically. So that would be step 2. Step 3 would be once they looked at the map, we would push a third offer to them that would give them a lot more points if they actually walked into the clinic. We would never reward them for getting their flu shot because that's pushing things a little too far, and that's when incentives actually start to fall apart. But we would reward them for the extra step of at least walking into a clinic. And the way we would know that is we would actually send them to the pharmacist who would actually give them a little bonus card, and they would enter that number in their app. So this sequence would actually take a very large number of people and then gradually funnel us down to a very specific target audience that we would manage to put all the way into the clinic. Same can be done for smoking cessation, for 1,000 other things. I will soon shut up and I'll open it up to questions, but I'll tell you a couple of quick stories about where this has gone and where this is going. We launched this, frankly, with modest expectations because it was such a radical departure from how government used to approach citizens about health promotion. So we expected that we would see perhaps 10 times the conversion rates of advertising. We never thought we would see 70 or 80 times the conversion rates of advertising. We thought that after a year in a small province like British Columbia, we would have maybe 20,000 of their citizens engaging in an app like this, which would have been a win for government. Believe it or not, we're closing in on 200,000. And across the nation right now, we have 2/3 and climbing very, very quickly. Ontario launched a few months ago, and of course that's adding, that might be me causing this. Get away from the speakers. So that might be adding a lot more users into the mix. But more importantly, what's happening in Ottawa now is every other policy domain in government is realizing that such a public engagement platform could be used for everything. It doesn't have to be just for flu shots and smoking cessation. It can be used to promote financial literacy. And when you think about it, financial literacy and health literacy are fairly interconnected. So if we make our fellow citizens more financially literate, chances are we're also making them more aware of their health. It can be used for environmental and carbon policy literacy, which is a big deal right now for governments across the board. And many, many other things. If you can believe it, even StatsCan has now become a partner of Carrot and is using Carrot to reach us as citizens in a much, much more effective and a much more real-time way. So I'll close by telling you it is something that was invented in our country. It works incredibly well in our country because we are so addicted to our points and so addicted to our phones. But we're not the only nation that's addicted to their phones. And points programs exist in most Western consumeristic societies. So there's all kinds of possibilities now for Canada to export this idea into other countries. The results continue to pile up very rapidly. Carrot's only been around for a year and a half, and in some provinces it's only been around for a few months, and already we're seeing some pretty dramatic results. And the sky's the limit. Even the private sector is now looking at this. Insurance companies are looking at this and saying, hold on a second, if this works so well for governments in getting people to be more physically active or to be more aware of their health, it could produce huge, huge results for insurers in terms of bettering the behaviors of their clients. I will stop there because you'll discover that most of the knowledge you'll glean from this comes from the Q&A. So please don't be shy and toss that mic around. The mic is right there at the moment.
Oh, thank you. Hi, so I'm sure I'm not the only one that just tried to download Carrot and was told that it's not available in my province yet, and being from Alberta. So when's it coming to Alberta?
That's actually not my job to answer that question because it truly depends on every provincial government when and how a province launches the app. I forgot to mention at the beginning that the federal government of Canada, which co-created the app with us, provided funding for us to reward Canadians for downloading the app. So what you'll discover when you're able to download it here in your province is that you'll earn a pretty significant chunk of points just for downloading it. It's a free app, and essentially the government gives you an extra reward for getting it. That's all funded federally. The other thing that the feds fund is referrals. Just like Uber, with Carrot, if you refer anybody, you'll immediately get a lot more points for that referral, and that incentive is limitless. If you happen to have 1,000 friends, you'll get 1,000 times the points, which is a beautiful way for an app to go viral, and perhaps that explains why it's so popular in other provinces. The next thing that happens, however, is the usage of the app is funded provincially, simply because the health promotion priorities vary from province to province. So each province figures out what they want to use it for, and then they create funding for it. In most cases, they don't have to find new funding. They simply replace some of their advertising budget with this. And each province comes and approaches us at their own pace and launches it. We try not to push it. I hope that all the provinces feel that we've never pushed it. So it launched in BC first. Very quickly after that, it launched in Newfoundland. Newfoundland, by the way, interesting social experiment. Because it's a very small, tight province and extremely networked, every Newfoundlander knows every other Newfoundlander. The viral spread of Carrot in Newfoundland was record-breaking. There are twice as many people per capita in Newfoundland already today that have the Carrot app as there are in BC, where it's been around the longest. So it's a fascinating social experiment. Ontario was third. We're fairly convinced that your province is fourth. We've been in some interesting discussions with your colleagues in Edmonton, so stay tuned in short order. Sorry, go ahead.
Have you done any work with respect to small incentives like this in changing physician behavior?
I think that wins the question du jour award. Physicians are consumers, so we haven't done it yet, but we're getting more and more inquiries about moving towards the health care space as opposed to just the health promotion space. We were just recently in Ottawa having a discussion with the part of Health Canada that looks after the opioid response. And more specifically, we're talking about the frontline workers in opioids. Now, that's not quite physicians, but there's definitely some opportunities there to reward folks on the front lines in order to get more real-time data out of them in a consistent manner. So Interesting point. I think the possibilities are there. I'd love to pick your brain later on about what exactly that might involve. Thanks.
Yes, hi. Chad Dickey. I'm a patient partner from Victoria. Question for you is two. First, the target population that you're reaching are affluent. They have smartphones, they have access to the internet, they know how to use the internet, but what about people that are marginalized and can't and are also using the emergency rooms frequently, and Northern Canadians? They don't have access to that. Plus also, not everybody is able to have the data capacity in the plans to use those. So you're missing a big chunk of the population, but also I think you're generalizing that everybody here in this room could use it, but somebody in the lower economic social determinants of the health ladder cannot. And those are the ones that are using the emergency rooms the most. Those are the ones that have to be helped the most. Those are the ones that have to be nudged the most. Those are the ones that have to be used social patterning to help them to improve their behavior. So just wondering how this can be tied into that in any way.
I will shock you with my response.
Okay.
So two halves to my answer. First, you mentioned the word affluent, and I will surprise you by telling you, and maybe it will make sense to you, that the lower someone's income, the more responsive they are to incentives like points. When you think about it, if you're earning $1 million a year, earning a free movie or a free flight out of an app like this is not going to change your life. But if you're earning $20,000 a year, all of a sudden the free movie makes a real difference. So historically, the loyalty industry has performed even better at lower incomes than it does at higher. Second point, you would be amazed at the smartphone penetration in our country, or the phone penetration in our country in general. In fact, if you move into those very difficult to reach population groups, who would be even more difficult to reach through the conventional methods, because they're not on Facebook, or they're not driving around and seeing billboard ads. You're not on Facebook. There's one person left. But the remarkable thing is when you move into those segments of the population, they are even more likely to have a phone as their only communication device because they might not be able to afford a computer. I see that you have a computer.
My phone?
Right.
I don't have a smartphone.
But you can afford to have a computer at least. So you're not one of those people.
Through my education.
Right. Well,
I just want to make another point though. It goes back to this morning session where I think it was Stephanie had mentioned something about...
do you want a mic so they can hear you? Okay.
Just because of the fact that there is a generalization that everybody is at the same level. And that's not the case. I really, as a patient, I'm from Northern British Columbia. I've lived in the Yukon. I've lived in Inuvik. I've traveled up north. And some of this stuff sounds great for the 90% of the Canadians that are living within 50 miles of the US border. But for the rest of us that live in Northern British Columbia, Northern Alberta, Northern Saskatchewan, it really is a challenge. And part of that is to make that a realization and realize that we're talking more about, not just about healthcare, we're talking about the social determinants of health. We're talking about a broad scope of things. Because there's people on my First Nation reserve that know they don't have access to a phone. And plus also, even if they did have a phone, they have a minimal data plan, if they have a data plan at all. My sister has a text plan only. She has a smartphone, but she can only text.
Right.
So there's a lot of assumptions here.
I don't want to keep up everybody. We can talk about it afterwards, but the one thing I'll say to you in response to that is you'd be amazed at how we over-index towards lower income. And I agree with you. There might be small slivers of the population that may never be able to access platforms like this, but I would also argue that this kind of platform does way, way better than the old way in terms of reaching all kinds of corners of the population. And we designed it on purpose that way. We can chat afterwards. Go ahead.
Hi, everybody. My name is Iris Kish, and for the record, I have a dumb phone, and I'm happy. It's not connected to the internet. But since you collect points, and I assume that those points go to a name, and the data, the points are, say if I got onto Carrot, the points would be collected under my name, correct?
Correct.
And that phone, if it was smart, it would track where I went, where I could get those points, etc. What do you do with all that data? Look at the data you're accumulating. You scare me.
I am amazed that it took this long for this question to come up. It's usually the first question that comes up. So the only reason I should not scare you, or the government should not scare you about these things, is because we live in Canada. We live in one of the most privacy-regulated nations on the planet. Absolutely collect an enormous amount of data. In fact, one of the scary things that I'll tell you to make you feel even more scared is we just crossed the 1 trillion record mark in terms of how many data records Carrot has already accumulated. We know how much each person has walked each day. We know what postal code they live in. We know 1,000 other things about how they answered quizzes and their attitudes and so on. The great thing about it is that data has to remain anonymized forever. So we may have a record about you as a person, and we know that there is somebody like you who smokes too much, walks too little, lives in that area, could use this kind of improvement in lifestyle, but it is never, ever under your name, and it could never be revealed to anybody. And that is the law in our country. So the beauty of it is...
Hacker?
Pardon?
Not even to a hacker?
Well, I suppose if somebody hacked a system, these hacks happen all over the world in different corners, and yet you've never seen something that compromised you as an individual. They get a lot of media, but they're actually fairly rare. We have done everything we could to protect this thing. It's been around for a couple of years, not the slightest hack. Somebody has to at some point accept the risk of collecting data in order to use data to make life better for the broader population. And that data is proving very useful. Sorry, I lost track. Oh, you went there.
First, just a small comment to say how great it is to have the patients in the room that are asking the really tough questions. So really, really appreciate that. My question is about persistence. So I was an early downloader of your app, really enjoyed it for the first couple months. And then fantasy football season started ramping up. All of my excess smartphone time has been diverted in that direction. And to be honest, I haven't opened it in a couple of months, probably 2 months. So what does your persistence data tell you about how long people stick to this, and what are you doing to keep people involved in a medium to long term?
Right. Yeah, perfect question. So believe it or not, wellness apps in general have a terrible, terrible attrition track record. I saw a stat last week that said that after 9 months, something like 89% of wellness apps get deleted off people's phones. Well, the amazing thing, so one can never measure exactly, so we can't tell you exactly what % of our users have deleted their apps, but all I can tell you is that almost 80% of our users are on the app at least once a month. 80% of the users who downloaded it once upon a time, which means that at an absolute extreme, we've lost less than 20% of them. What's even more amazing, though, about our app, which is apparently the envy of the app industry, is 50% of our users are on the app every day, right? So clearly, we have nowhere near 89% attrition because 50% of them are there and alive every day and talking to this thing. But I think we have almost no attrition. It's impossible for us to find people out there who have deleted this thing completely. And there's lots of things we can do, right? There's days where we suddenly push out a double your steps rewards offer. In fact, my team just came up with a wild idea. If we wanted to be a little more daring, why couldn't we reward Canadians extra for achieving their step target every day if on that day they also went to the gym? So imagine if we put beacons at gyms all across the country, and every time you showed up at the gym, your activity rewards doubled for that day. All of a sudden, we'd have people going to the gym more often, right? Or let me take it a step further. What if we started rewarding people or reaching people every time they stepped into a fast food place? So you walk into a McDonald's, and all of a sudden Carrot pings you and says, hey, take this quiz about healthy living, healthy eating right now. And you could literally influence the behavior in front of the counter. And frankly, you want to push this to a real extreme? Imagine if the restaurant was pushing out that quiz and directing you towards the half of their menu that's better. So the possibilities are endless in terms of both continuing to influence behavior, but also increase engagement. We are seeing, honestly, record levels of engagement in that sense. So thanks for the question.
But eating healthy, you mean?
Yes.
If your app could go even further to work as eating healthy.
For sure, for sure.
For everybody.
Sorry, somebody has the mic back there. Go ahead.
So my question is related to your background. I noticed that your application of this function is based a lot on behavioral psychology and motivation studies. And I've even studied, or it's in my bachelor's degree, I've heard of studies that were focused on, planning to get vaccinations, and people who actually formulated a plan to go to the vaccination clinic were much more motivated to actually get the vaccination and follow through with it. So I understand how successful you've been in this application development, and I wanted to know if you have a team of people who study the psychology of behavior.
I do, and you heard me make a reference earlier to nudge theory. For those who are not familiar with nudge theory, nudge is right now all the rage among policymakers across the world, because nudge is proving to be 1,000 times, many times more efficient than the old way of trying to scare people away from smoking or obesity or whatever. Well, when carrot was still theory 3 years ago, I was speaking at an event like this by the Conference Board of Canada. And I was describing the concept. And it was a concept that we and the federal government, the public health agency, were co-designing at the time. And a hand went up in the audience, just like yours. And this fellow kept asking me the toughest questions, but he was so scientific about it and so respectful that eventually when I got off the stage, I asked someone, who was that man? And they said, oh, you haven't heard of Dr. Mark Mitchell. And it turns out Dr. Mark Mitchell is the only Canadian who has actually earned his PhD on the magical intersection of incentives and public health. And so, believe it or not, a month later, Dr. Mark Mitchell was working for me and is still working for me. He now leads this amazing team of behavioral scientists that we've designed inside the app. So for people in the room like this fellow who has the app already, everything you see through the app, every quiz and every step reward and everything else that comes through to you has been through an incredible filter of behavioral scientists that know exactly how to, frankly, manipulate you in a positive way. They know exactly how to word the quiz to make sure you learn the most from it, even though you think you're just playing a little game. And the reason I'm saying this with so much confidence is I, as the founder, find it incredibly fascinating every time I take another quiz, because I learn something else from it, even though I think I can gain my own system. They are, behavioral science is an incredible field. It works so incredibly well, and the results are now out to show that it does work, right? We got people walking so much more, learning so much more, changing their attitudes, and so on. So thank you. That's our proud question. We have a hand up here. Oh, Mike's over there.
I have the box. Hi, I'm Tina, and in a past role, I worked at an educational technology startup that used gamification to get kids outside exploring parks. So I'm wondering if, just to go over some really high-level statistics, childhood obesity is a really big problem in North America, as is child inactivity. So I'm wondering if carrot is it used by children, and are there any plans to make a reward system that would be appealing to Canada's youth population?
Tricky, oops, I'm off the mic, there we go. Tricky question, because you don't want to get to the point where you're manipulating children with commercial rewards. One of the reward providers we have on the app, which has proven to be the most popular choice, by the way, among Canadians, is Scene Points, which gets you free movies. And Scene goes all the way down to the age of 14. So we do have a lot of 14-year-olds collecting Scene Points through carrot, but that's the bottom. If you want to reach populations of younger age than that, you do it through the parents. And we do have a lot of children's activity quizzes and offers and videos that come through in the app that we believe are making a difference in attitudes, but we think that's the safest method. We skew slightly female, which is also a good thing for policymakers, because we typically skew towards mothers who would influence the behavior of their kids. But yeah, no plan to go beyond that, frankly, because that's tricky territory. I keep losing track. And then we also have a hand here, by the way. Hello.
Hi, my name is Elaine Keenan-Banks. I'm the Information and Privacy Commissioner in the Northwest Territories. And you got off way too easy on the privacy question. What you're telling me scares the crap out of me. Because it's all fine and good in the health with what you're doing with it. But let's get this technology in the hands of an insurance company or other profit-making institutions. You're tracking people, you're gathering their personal information, and as far as I know, there's nothing that prevents you from passing that information on. So I'd like you to give us a little more about the privacy protections built into this.
Yeah, so actually there's plenty that prevents us from passing on that information. I'm not the privacy officer of the company, so I wouldn't be able to give you the specifics right now, but we, with every province and territory that we deal with, and we're not dealing with NWT yet, we have to pass through the privacy assessment of that specific province, and they have to see exactly what data gets revealed to the province versus the feds versus a potential private sector partner. But just to reassure you, if there was ever an insurance company on the program, the only aggregate data they would be able to get their hands on is data that's driven by the offers they are pushing out to consumers. So let's say that in Northwest Territories, your government couldn't afford to reward its citizens for achieving their daily step targets and somehow brought in an insurance company as a sponsor of that. Then the only data and only aggregate that insurance company would be able to see would be in terms of the percentages in the distribution of how many people in your province or in your territory are walking more. Absolutely nothing else. And we deal with your peers in every single province, and I'll tell you that is usually the toughest step before the app launches in that territory. So I'm glad I scare you, but believe me, it happens in every territory like that. I see a hand up, but I don't know where the mic ended up. Oh, sorry.
Steve Ederdy from Calgary. I guess I just want to push a little bit more on that, but and feel free not to answer it, but the motivation for this has a powerful profit incentive, and I'm wondering how you protect your company or the people that are part of it from when this gradually gets bought out by others that may have not the positive approach that you're taking. What's the protection?
Well, I'm glad you bring up the nasty P word, because we designed our business on purpose to be a B Corp. I don't know if you're familiar with what a B Corp is in today's modern world. It's a new standard, a new global standard that creates an authentic hybrid kind of company that's not strictly for profit, but is also not a not-for-profit. The only way my company is allowed to generate a profit is by creating a direct drive relationship between profit and impact. So the only way I can charge my clients, which happen to be provincial or territorial governments, a penny for the points that they're buying to give to you for completing a quiz, is if I can prove to them that those points are doing something, that you are actually completing the quiz. If you don't achieve your target for the day, if you don't achieve your step target, or if you don't complete the quiz, you don't earn a point, and I don't earn a penny. So my motivation and the motivation of the provincial government authority is so completely aligned. We want as many people to take their smoking cessation quiz, or we want as many people to achieve their step target for the day, and only then do we get paid, which is exactly the opposite of what used to happen before. When you think of how our governments used to give away our money to ad agencies for running billboard ads about smoking or about the flu, without any accountability whatsoever. Nobody knew how many people saw the ad or if the ad had any impact. To me, that was unregulated profit. The version of what we do is 100% regulated because it's 100% driven by success. And if we ever fail, if we ever push out the wrong offer to consumers that doesn't appeal to consumers, it doesn't change their behavior, and they don't earn their points, we don't earn any money. It's that simple. So thank you. That's actually my favorite question, because people look at you and they say, so you're making money to try and make people healthier. And my very, very honest answer is yes, but I only make money if I do make people healthier. The mic traveled again. Oh, same table.
Hi, my name's Claire Perry. I work at the Ministry of Health in New Zealand. I was just curious, thinking of inequities of access, because I think your cell phone usage here is at 67% for smartphone usage in the country. So you just picking up on the gentleman at the front who was talking about those people that don't have cell phones. So I'm just curious in terms of the contracts that you have or that you work with the provincial and the provinces
and territories,
and the territorial contracts. Is there any incentives built in for you to access the population that don't come to you via smartphones?
Well,
so over time.
So just a slight correction. The 67% you mentioned might be a New Zealand number.
No, ours is 70 and yours is 67%.
Ours is not. You must be looking at very old data. Ours is actually north of 80 now. In fact, it's heading towards 90 very rapidly.
Okay.
Yeah, smartphone penetration in our country is incredible. It's among the highest in the world.
Sorry, I
So no, the whole principle behind the design of Carrot was the assumption that eventually every Canadian, or almost every Canadian, will have this device. So we thought, what is the most common platform on which we can get the population? When you think about it, the old way assumed that somebody would be on Facebook and see an ad, or somebody would be driving down the highway and see a billboard, or somebody is watching TV. And none of those platforms are ubiquitous either. But the assumption behind the federal government's creation of Carrot was that smartphones are essentially ubiquitous. So that is the easiest way to reach as wide a cross spectrum of the population as possible. So that's it. The rest of it will happen organically. The 85% today might become 89% next year and 93% the year after. It's literally rising that quickly that we will eventually get to a point where virtually every Canadian has a smartphone in their pocket.
Last question.
Last question indeed. I'm looking at the clock here, yes.
Thank you. My name's Jessica Havens, and I'm a patient partner. And I just noticed that most of the things you've described, most aspects are for able-bodied people. And as someone in a family of chronic conditions with a sister in a wheelchair and a brother who is partially blind, a lot of this would not be applicable. So, and I think this has a lot of opportunity in regards to self-management for those who cannot meet normal able-bodied goals, in regards to adjusting it to be for people who have different health goals instead of the everyday ones. Is there any possibility, and do you have any aspects of the app in regards to that right now?
I think you should come to my office and speak to all my colleagues who are so passionate about exactly this. Every single time a new type of offer is brought to us by a provincial Ministry of Health, my colleagues come to me and say, what about the blind? Or what about those who can't walk? I'm blessed to be surrounded by a bunch of young people in the company who believe in this kind of stuff passionately, and we're looking every single time to figure out how to tweak it. So thank you. That's an awesome question. In fact, I'm going to go back to the office with it. Say it came up in the audience. That's great. I think we have 1 minute, so we have room for just one more quick question. Sorry, guys, you put the mic away, but this was so quick.
Oh, we got one over.
Who?
Hi, I'm Miriam from Montreal. I downloaded the application, obviously told me that it doesn't work in Quebec. But my question is, if I follow the logic of where you are going, there's another big chapter which would be to encourage people to eat better, to have obviously a better nutrition. Any reflection how you could capture, obviously there's something which is difficult to measure how well people have eaten, but you could also offer them coupons to go back and buy vegetables and this kind of thing. So I would like to know your reflection.
Thank you for that, because that's a huge part of the story. And instead of answering the how it might happen in the future, I'll just tell you a very, very quick story about the past. Before this was an app, in my previous business, we were experimenting with kind of basic elements of this idea. And in British Columbia, in the summer of 2010, we tried something that no other country in the world had tried. We gave British Columbians a very significant number of points. In that case, it was air miles for going to the grocery store and buying at least $15 worth of fresh produce, which is something we can track very easily, of course, through POS. And the amazing thing is I don't know if you know the statistic about our country, the average Canadian only spends $6 on fresh produce when we go to the grocery store. So we purposely drew the bar much, much higher than that at $15, and we dangled a pretty significant reward in front of every single British Columbian, and we said, go and try this. The results were staggering. Staggering. In 1 month, we increased the consumption of fresh produce across the entire province by 4%. And if you know anything about the grocery business, that's a gigantic shift. So yes, the opportunities are massive. Whether we will do it in the future through POS or whether there's other ways to track it, we're working on it. But already we educate people about how they should eat, and the next thing would be to track actual behavior. Thank you very much.